I think CAAS will provide us with the opportunity to pull together the range of clinical effectiveness, of patient safety and clinical governance initiatives that we're currently involved in, and bring it together under one umbrella, and provide us with an opportunity to assess compliance within the context of an accreditation framework.
I know that we deliver really good care in the 3 boards in paediatrics, maternity and neonatal, but what we don't do is that consistently. Patients tell us that, some of our inspections tell us that. So CAAS will give us a real focus, and it will allow senior charge nurses and their teams to demonstrate that they are delivering the best that they possibly can.
What we hope that CAAS will do is provide a conduit for all of the various strands of work that happen currently, and it will provide a building block that future initiatives can build upon.
It will mean that it will very clearly lay out what's expected of staff, team leaders, charge nurses. It will provide assurance to the board that we're actually meeting the standards, that we're providing high quality patient care, and where we're not, then we can take appropriate steps to rectify that.
I think it will be a challenge to staff to begin with until they're familiar, but once they realise, actually I do this and this gives me this opportunity to feed back and show patients that we give a standard of care that we want to give, then I think they'll take it on board.
I think the early stages, it's around refining the tool, so refining the standards and the framework, and working with the identified test sites. So we have within NHS Glasgow and Clyde identified 4 wards. So it was working with the senior charge nurses and their teams in helping them get their head around how they would demonstrate compliance with the standards and some of the challenges associated with that. At the same time, at a corporate level, thinking about what support they would be required and how best we can mobilise that support.
We would test it in small areas within the board, different areas. We would get the content, the language, the standard right, and then once we'd got that right, we would then further test it in different areas. So it's early stages just now, but we're on the way to, probably in the new year, to doing some testing.
I think nurses absolutely recognise the standards. They realise that that's what they do. I think it will take us into a really good place. Nursing and care delivery has had a bit of a hard time. I think we've lost confidence in terms of the public. I think this will allow us again to kind of take back our place in terms of how the public feel about nurses, nursing and caring in the NHS, because it will give them confidence again that when they come into hospital or into GP surgery or indeed get care delivered in their own home, that it's done by nurses who are caring, who are compassionate.
Senior charge nurses and service leads will be able to influence the care that they are delivering and assure themselves that 100% of the time patients are receiving the absolute best care that they possibly can.
I think it will give us a standardised approach going forward. At the moment we have a number of initiatives going on which look at quality in the workplace and that our staff implement at present. However, this overarching framework will let us present things more logically, let staff know where they are, and more importantly, let our women and our families know where we are.